Dr. Paul Harris here. We're going to be speaking today about the Functional Binocular Assessment Test. This test has been a long time coming and a lot of people have contributed to it. I want to particularly mention Dr. Gregory Kitchener for his long-term involvement in working with each of the pictures, each of the plates, the instructional sets, and all of that. I want to particularly thank Bernell for their continued support, Rivalry over a number of years in terms of helping us have a product that really can work well. This works with a number of different populations. It replaces a test or probe that we've not been able to get for quite a while and be printed in a way that will cancel well and do all the things that we really need to do with the different populations we're working with. Bernell has printed this one on a rather thick plastic that should hold up very nicely. Prior products have been on paper and not really held up very well. One of the difficulties we were running into was the cancellation problems, and Bernell, with the new green filters that they have and the better printing works very nicely with this product. What I want to do now is to go through each of the plates and give you a sense of how the Functional Binocular Assessment Test, the FBAT, really can help you gain insight into the level of binocularity that each of your patients has. In particular, I find this very helpful for patients who are either nonverbal, very young, still acquiring language, infant assessment, toddlers, etc. But I also find it extremely helpful with our acquired brain injury and traumatic brain injury patients who may be compromised with their language abilities as well. Finally, there's the group of our amblyopes and strabismics, where this test was designed to help us get a very good sense of the level of binocularity. So let's now go through each of the plates. The first plate is the bird in the cage. This one is simultaneous perception, or many people call that first degree fusion. There's nothing the same that each eye is seeing except the edge of the actual card itself. So just to give a little additional background for how these work. The right eye in each of the glasses has a red filter. The red sees the white background as red and sees the red figure as red. There's no contrast between the red of the figure and the red of the background. Therefore, the eye with the red filter on it does not see the bird. The eye with the red filter again sees the background as red, the white background, but it cancels with the green figure that's the cage that's printed. Because it cancels, it sees that as black. The black on the red background has contrast. Therefore, the eye with the red filter sees what's printed in green on all of these cards, and the eye with the green filter, conversely, sees everything that's printed in red. So, the information that's being seen by each eye or each channel is the right eye is seeing the cage, the left eye is seeing the bird. If the person has simultaneous perception, if they're processing the signal through both channels at the same time, then they would see both the bird and the cage. And that's our main question here. What do you see? And we're hoping that they say they see both the bird and the cage simultaneously. You can also ask questions, where is the bird relative to the cage? But there are no fusion locks, and this is not really used for measuring that specific location. The next plate has two crayons. These are relatively small. The only printing in black that would be seen by both eyes is the label all the way out on the right, and most likely is not much of a fusion lock. Again, the outer edges of the card could be seen as a fusion lock, but primarily what you have is, again, the eye with the red filter seeing the green crayon, the eye with the green filter seeing the red crayon. So at first what we're asking is, what do you see? If they see two crayons, then I would ask, are they pointing at each other? Is one off to one side? And to put that into words. If they're aligned, one directly above another, then they are looking at the plane relative to the card, not closer than it or further than it. So first, simultaneous perception. If they only see one of the crayons, then they are only attending to the flow through one channel. And you can check this by covering one eye, covering the other eye, and then letting both eyes open and asking them what they see. What we have here is a complex pattern. You have diagonal lines going from top left to bottom right, and diagonal lines going from top right to bottom left. And you have this very strong black circle in the center of the plate. So the black circle is to be seen by both eyes. And if you want to think of it as a fusion lock, it could be seen as a fusion lock, though we're not asking them how many black circles do you see. We're simply asking, what do you see? Now, this is called the Retinal Rivalry slide because the typical thing of a person who has a normal binocular system, what they would see is, for a short period of time, 3 to 5 to maybe 7 seconds, these lines dominate, and then it switches to these lines dominate. I don't mean that all of the other lines are gone, but typically one or the other is going to dominate, and they're going to alternate back and forth. Again, this can be on the order of several seconds to maybe 5 to 7 seconds, one dominating and the other dominating. What you can do is ask them to describe what they see, and they should be relatively the same amount on the diagonal lines that go this way and the diagonal lines that go this way. Typically during the transition from one to the other, there may be a short period of time where they actually see this cross-hatch pattern that would indicate that they're seeing out of both simultaneously. So don't be alarmed if they don't report seeing it as it actually is printed on the paper. This is all about retinal rivalry, and it should alternate from one pattern to the other. What we have here is an indicator of vertical alignment. What you see are a bunch of lines and numbers printed in red. So if you remember, it will be the left eye that sees the indicator numbers. And then there's a single horizontal line that's printed in green and is seen by the eye with the red filter. What we ask here is, first of all, do you see the lines, the indicator lines with the numbers, and do you see the long horizontal line? If they see both, then again they're processing out of both channels at the same time. And we ask, what line does the horizontal line go through, the big long one? Does it go through, if it goes right through the 0 in the center, there is no hyper or hypophoria, one eye pointing up or one eye pointing down. If these are held at either 16 inches, if the patient is 16 inches, or 40 centimeters from the card, it turns out that each of these numbers, each of these lines, is one prism diopter of misalignment. So this is one for your your vertical Fourier testing. It's horizontally organized so that it can float up or down. And on the very next card, you'll see the same thing, but it's organized to get a horizontal measure. The lines are vertical, again, if held at 16 inches or 40 centimeters. Each line is a prism diopter, so this would be 5 prism diopters, 10, 15. So it's a way to get a free space measurement, actually. Now that would require a verbal patient in order to give you the indication of the amount of misalignment. Here we have two spaceships or rocket ships. This has been organized in a very specific way so that if the glasses are worn, again with the red over the right eye, that the smaller, higher rocket should actually be seen floating off the page more. What I typically ask the patient to do is to just touch the little rocket. And what you're looking for is for them to rotate the hand, either to stop like this and touch in front of the paper, or to rotate the hand like they're going to grab or pinch the rocket off the page. That's the way with our nonverbal patients we get an idea that they're seeing a float. You'll get this little movement, they'll come down. Often there may only be a hesitation here and then they go to touch the paper. So you have to sort of set this up, touch the rocket. I don't show them that, I just simply watch for the movement. All of these, by the way, if you turn the paper upside down, the disparity reverses, and now the smaller rocket would be seen further away. So keep in mind that this is a way to, that you can use this, and it makes it a little more versatile as well. What we have here is a large running horse. And the horse is not a flat picture raised off the page. But when you look at it, you'll notice that the front part of the horse is much further off the page than the rear part of the horse. So there is some second degree fusion here in that the picture should be rotated off the page like this. What I do is ask the person or the child or patient touch the tip of the nose of the horse, okay? Just pet his nose or touch the nose. And again, what you're watching for here is that they stop in space. Now some of them will go directly to either the red nose or the green nose and go directly to the plane of the test plate. If they do that, they are telling you which eye is leading the movement, and it's not really as binocular as we'd like. So again, remember which eye is seeing which color. If they go to the nose of the red horse, the red running horse, what they're doing is they're going to the one seen by the left eye. The left eye typically would have the green filter on it. If they go to the tip of the nose of the green horse, the one printed in green, then they're predominantly being guided by what is being seen by the right eye. Here we have a series of circles, with the black star in the center. The black star, again, is seen, anything printed in black is going to be seen by both eyes, and that would be a type of fusion lock. And what you have here is each of the circles has a little bit more, and a little bit more separation. So each of these circles, as they get larger, should come out off the page more. And I often ask them to touch the outer one, and you get the movement again. I might ask them, are they looking into a tunnel or is the star the closest thing they see? If you turn this upside down, the disparity reverses and the entire picture should change its orientation. So keep that in mind as a quick way to check if they're really using the information coming in through both eyes. We look at the next plate. You have a series of figures that we call fish on the move. And each of them is at a different plane in the picture. Some are behind, most are either even or further out. What I typically do with this one is ask them to touch the closest fish, and then if they're verbal, to tell me which ones go backwards from there in sequence. Here we have the dancing hippo in the large circle. This one takes up the most amount of retina, the largest visual angle of all of the figures we're working with, and it has a very large, thick reference circle or fusion lock. Often you will not get the appreciation of depth with some of the other figures, but you will with this one. If this is the only figure of all of these that they show the depth, then you at least know that they're using the binocular system, but it could use a lot of assistance or refinement through application of lenses, prisms, and vision therapy. So again, with the dancing hippo here, this should be out in space. Turn it upside down. They should tap or touch the card. Cannot get all the way there. Come back and watch them out in space. The very next plate is the teddy bear. And if you notice, if I go back and forth, the teddy bear is smaller and it's not as separated as much. The idea here is to give us some grading in terms of the amount of stereo or the amount of depth that the person has, to give us a sense of a grading in their degree of binocularity. So you may see it with the dancing hippo, but not with the teddy bear, and that gives you a sense of again, how well functioning their binocular system is. If both of them show the depth and the touching in space appropriately, then that would give us an indication that their binocular system is functioning a little better. Next plate is a very simple plate. You have this spirograph type of figure. One of them has the red and green ones printed in exactly the same location, and the other has it so that that figure, the one here on the lower left, is popped out off the page, again, if the red filter is over the right eye. I typically ask the patient, which is the real one? I know it's an odd thing, none of them are really real, but that seems to get them to go directly to the one that's off the page. If it's off the page, it therefore must be real, probably not a picture. I've never asked somebody to interpret my language that way, but that's typically where they go. Turn it upside down again. This one would now be far or behind the plane, and this one, it's popped out. And that's the new test. Again, the Bernell Functional Binocular Assessment Test. Again, thank you to the persistence of Joe Villari over a number of years in helping to get this product done. Tremendous thank you to Dr. Greg Kitchener and to Chris Andrews for persisting and working with all of his wonderful people, art design people. We went through many iterations of the product, and we hope you can find many patients to use this with to gain insight into their degree of binocularity.